Dr. Jaffe, will you please tell us or explain to us if the LRA by ELISA Act test could be used to detect sensitivity or immune reactivity issues with metals that are used in dentistry? The most commonly used metals in silver or amalgam dental fillings are copper, gold, nickel, silver, and tin.
Very important question. Now, we do recommend the depenicillamine provocation to look at essential beneficial minerals, as well as toxic mineral burdens. And yes, these minerals in these dental materials actually exist in very complicated forms. So we think of iron as being +2, but sometimes it's +3. When it's +2, and you have enough antioxidants to keep it in the ferrous +2 state, the body without harm can manage the iron. When you're in a high oxidative state and the iron goes to +3, or the copper goes to multivalence, or the chromium goes to multivalent states, or other minerals go to multivalent states, now you have a physical chemistry issue, not an immunology issue. So the LRA test looks at hypersensitivity, delayed allergies over all the spectrum of delayed reactions, just as they happen in the body, ex vivo. However, when you get to dental materials, the Clifford test that has been used for decades is the most sensitive specific one that we know of for these materials that are themselves physical and not soluble. When you talk about the immune defense and repair system, you're always talking about something that got soluble, that may be attached to something else and changed its shape to foreign. But you're not just talking about the metallic silver or the metallic mercury. And by the way, there's metallic mercury, which is actually not that toxic. But if you use certain methylation compounds like methyl B12, you can actually convert metallic mercury into methyl or ethyl mercury, which is 10,000 times more toxic. So we need to be able to measure both the physical chemistry, the immune chemistry, and then the sensitivity, the reactivity to dental implants. They're different. And yes, we can look at physical chemistry. We can look at the immune responses. We can look at the whole person and how they respond to different materials. And yes, we're continuously learning. It turns out, for example, that hip implants were originally metal on metal until after some years we found out that when you have metal on metal, some of the surface metal comes off, and that is where on the surface of the hip implant was exactly where the chromium and the nickel and the other trace elements concentrated on the surface. We don't do that anymore. Now you either have a completely ceramic implant or maybe a metal on ceramic. And so we're constantly learning about physiology and pharmacology. And my conclusion is physiology first, and you rarely will need pharmacology. Get nature, nurture, and wholeness to be your advocates and your allies, which means use materials that are compatible by the Clifford method for dental and by the LRA test for the rest of the world.